Metro Health Hospital in Wyoming with how they're preparing. Good morning.
Well, good morning to the both of you. This is the first time actually doing a live report with a mask. Well, this is interesting. You can't really see my facial reactions. All right, so let's talk about it. It's been a busy morning so far here at Metro Health Hospital in Wyoming. Lots of people coming in, but it will begin to get busier as next week we open up to 16 years old and beyond, like you just mentioned. And joining me to talk about that is the Chief Medical Officer, Dr. Ron Griffith. Doctor, thanks for being here. Appreciate it.
Good morning. Pleasure to be here.
Well, let's first talk about the overall success so far in your eyes of the clinic here at Metro.
Well, we're very excited. It's been a great clinic. We've vaccinated over 25,000 people here at Metro Hospital. We've also had some clinics in outlying outpatient centers, and we helped staff up a couple of centers in Ottawa County also. So again, over 25,000 people vaccinated here at Metro Hospital.
And just from watching so far this morning, it seems like things are running very smoothly.
We've spent a lot of time trying to get our process in place so that we can make it as painless as possible for all the people to come in, quickly get their vaccine, observe them for a short period, make sure they have no problems, and then get them on their way to get back to living.
So let's talk about what's going to happen starting next Monday with the eligibility opening to 16-year-olds and plus.
Sure.
First, take us your thoughts on 16-year-olds, teenagers getting the vaccine. What's your take on that?
Well, first let me say the vaccine is very safe. The science has proven it is very safe and effective, and getting it to people 16 and older would be very helpful, because we see just recently there's been an increase in patients of that age getting COVID-19, probably because they have not had the vaccine available to them. So being able to provide that to them should certainly help keep them safe and also keep them in school, which is very important.
And of course, obviously there's people who are concerned, and even though you said it is safe. Any advice for those people, especially parents of teenagers?
Sure. No, as I said, we give kids lots of vaccines, but the science behind the COVID vaccines, all three of them are very safe, they're very effective, they work. We've had very, very few people require hospitalization after getting the vaccine. So the more people we get shots in the arms to, the better off we're going to be. The sooner we can get rid of masks and get back to normal life.
And as far as any changes with the influx of people possibly coming in next week, are you making any changes, or will it stay the way it has been?
Well, we'll be ready. We've got a great staff here. We're going to get it staffed up. We just hope we get enough vaccines so we can immunize as many people as possible. Because right now, really, the vaccine availability has been the limiting step as far as how many people we can immunize. But we're ready to go. Look forward to getting our community healthy and safe.
All right, Dr. Griffith, thanks for being with us this morning. We certainly appreciate it. Like I said, there you have it, guys. More than 25,000 people have been vaccinated here at Metro Health as of yesterday. And, of course, a little bit later this hour, or actually I wouldn't say this, next hour, 8 o'clock hour, we're going to hear from the COO here at Metro Health. And Davis and I are going to get our second dose of the vaccine as he is waiting. Back to you.
There's Davis ready to go.